Good afternoon, everybody. My name is Jhoselyn Rodriguez. Thank you so much for hopping on today. I know it's probably been a crazy Monday, but I appreciate you, joining in and being able to get to know a little bit about what we do. But nonetheless, I guess we'll go ahead and start. So again, my name is Jhoselyn Rodriguez, and we are doing the meet and greet today with Coaching Salud Holistica. Um, as I am the founder of Coaching Salud Holistica, which we are going to talk about how we began, where we are now. But I just did want to share a little bit about myself, where my background actually is in health science. I've done a lot of work in terms of like the exercise science field and health education, and has a big role to play with how I came to be, the founder of Coaching Salud Holistica. My nationality from my mom's side is from Guatemala, and my paternal side is El Salvador. I did get the opportunity growing up to go to the countries in Central America to be able to be exposed to, the language, the culture, the food, which has been a great experience and a lot to do with who I am and, what we do here today. So a little bit more about myself is I actually graduated with my bachelor's degree of science in exercise science before COVID, and I was actually going down the route as a physical therapist. And with like everything, COVID-19 hit and kind of flipped everything upside down for myself, and I'm sure like for everybody else here. So during that time, I had the opportunity to work as a community health worker in response to the COVID-19 pandemic and worked with local nonprofits, universities like George Washington, and local hospitals in Montgomery and Prince George to provide assistance for our community in terms of accessing healthcare and just overall understanding, how to have a healthier lifestyle. What you see here on the left side here is working as a community health worker with the Salud y Bienestar program with the Latino Health Initiative. And in 2021, as I was continuing to work as a community health worker, I did have the opportunity to become a community health organizer. So for those who might not be familiar with community health workers, is that community health workers essentially are those who bridge or are the community liaisons between the healthcare system and the community. So community health workers can have a wide range of different roles and responsibilities, but the main goal of a community health worker is to help community members have access to affordable healthcare services that will essentially help them improve their healthy lifestyle or healthy life. We know that it's super important to go to your primary care doctor, but we who work in the community probably experience many community members who might not have that ability to go to healthcare resources, affordable healthcare resources due to immigration status, income, or all of the above, or just not knowing, where to go get healthcare services. So nonetheless, as a community health organizer, that's essentially kind of like a step up from a community health worker, and a community health organizer does a lot of like the canvassing, does a lot of like data collection, and a little bit of just overseeing community health workers and being able to organize events and attend health fairs and so forth. So in 2021, I was a community health organizer, and a lot of what I did was canvass communities to bring COVID-19 vaccination education into Latino and immigrant communities in Montgomery County and Prince George's County. So a lot of my work has always been within these two counties, serving the Latino and immigrant population. I've had the opportunity to work within other communities like the refugee community or the Black community, but most of my projects that I've been pulled into, or a lot of my role has been to be either a liaison or to work with the Latino immigrant community. So kind of fast forwarding from there, in 2022, I founded Coaching Salud Holistica as a consulting company for community health education programs and community health event organizing. And we're going to get down a little bit into, what is it exactly that we actually do. Many of you probably have seen our emails, our flyers, have heard us, have probably received so many notifications from us. Most likely that's probably from me. We are a small team, but nonetheless, we work to begin. We started essentially with the purpose of connecting community members to multilingual or bilingual health education workshops, as well as access to healthcare resources. Again, the community health worker model and standard. So as a community health worker, I decided to, really see how important it is to bring these services into communities. And with my work as through nonprofits or through the different other agencies that I worked in the past, I realized how limited, it could be sometimes in terms of zip codes, of grant funding, grant topics. Many of you probably have experienced that yourself, especially during the pandemic where everybody was focused on COVID-19, And, with that work, I absolutely loved it. But at the same time, I was very conflicted personally, just due to the fact that I couldn't assist everybody because they didn't live in our catchment area in the organization that I worked in at the time. So I wanted to fill in that gap, especially with, having a background in health education and health science. I very much missed that type of role and saw the need for it and thought, if we can only teach people about how to prevent, many diseases and even where to go, I know that that would be a huge assistance to, preventing medical bills in the long run and just overall improving the quality of life of, many community members, because it's not enough to have a long life, but to have a healthy life. So as a consulting company in 2022, when we began, we are essentially remote and based out of Montgomery County, but we're 100% remote in terms of like an actual office space. But a lot of our work does involve in-person activities, which I'll go into shortly. So, through this type of work, we've been able to connect community partners to one another and begin creating a community resource drive, which I'll share a little bit more as well as we continue going. And if at any point you have any questions, I'd be happy to elaborate, either through the chat or at the end. So in summary, our services include a wide range of things, but if we were to categorize it, it would be community resource education, one-on-one health coaching, and consulting. So it also should say just health coaching because we also do provide workshops, and that's a majority of our services that we provide. But looking at a little bit deeper, the way we do community resource education is through our WhatsApp groups, our website hub, and our outreach. So for those who have probably connected with me either in person or via online or through our WhatsApp groups, the WhatsApp groups that we have are essentially groups for community professionals. So schools, nonprofits, local government, anybody who provides some type of service to community members can join our WhatsApp groups. We have in total 6 WhatsApp groups that we manage. I believe, for example, like the Montgomery County one has over 200 community service people. And then Prince George has over 100 something. And our other groups have a little bit more. It ranges depending on the county. So the WhatsApp groups that we have are Montgomery County, Prince George's County, Baltimore City, Baltimore County, Frederick, trying to remember, I probably am missing a couple other ones, but nonetheless, it's covering most of Central Maryland. And the goal is to have community partners to connect on those WhatsApp groups, to share updates on the services that they are providing through their organization, to share upcoming events and resources that they come across, and to troubleshoot and receive support from other community service providers on a specific topic. For those who are familiar with the change that happened with the Healthy Babies Equity Act, the Healthy Babies Equity Act is essentially a law that was passed last year, but took into effect this year, that starting July 1st, many of the community members who could have qualified for Medicaid during their pregnancy, but did not due to legal status, will now be able to qualify. So that being said, our population that is undocumented and is currently pregnant, living in the state of Maryland, and is low income or income restricted, they would be able to apply for Medicaid during their pregnancy. So covering prenatal care and 4 months of postpartum care. So the reason I mentioned that is because it's something so new. Many of us are, having a hard time. We're coming across all these different scenarios and situations of, hearing different information and just overall gap of being able to apply for this program. So with our WhatsApp groups, that's been a common conversation that has popped up, just troubleshooting those scenarios that we come across, whether it's misinformation or just clarification on something or where to go to get a specific type of service. That is something that we talk about in the WhatsApp group. Of course, the WhatsApp group is completely voluntary. It is a great resource for yourself, because you are probably the community leader in your clientele or in the community that you're serving. So for you to have that type of support is the goal of this WhatsApp group. We have also a WhatsApp group that is in Spanish for Spanish speakers, for those living in Maryland to also see the resources that we have come across or the services that we're providing personally through our organization. So these WhatsApp groups, the way to join them, because that's often the question that I get following this, has been through QR codes, or links. So we have both. We have the WhatsApp group through QR codes and through links for many to join. So if you are someone who is interested because you work in the community and wants to, join these groups and just meet other people and just know what's going on in the community, you're more than welcome to join. And you can feel free to email me, which I'll also bring up my email again. And one of the things I did want to mention is we do try to avoid community members from joining these WhatsApp groups, and that is because sometimes we'll come across where community members share personal information, even though it's with good intention that they're trying to receive help or they're trying to help somebody else. So that's something we want to avoid, just to protect their personal identity. So that's why we keep it strictly for community service providers and school personnel and so forth. So feel free to contact me in terms of those WhatsApp groups. I'm pretty sure most of you have joined those groups through and have seen me send notifications very often in terms of those type of events. So a wellness tip, because we are Coaching Salud Holistica, we want to promote wellness, and so I recommend muting them. I did also forget to mention that our name, Coaching Salud Holistica. So we all know that coaching and health coaching is kind of a new terminology that we've heard in this past couple of years, but salud means health, and then holistica means holistic. So it's essentially translated to English, it's coaching holistic health. So yeah, I just wanted to share that. And then I know this is a wealth of information. I am recording it, so if you do want to rewatch, or if you came a little bit later, you're able to rewatch this video, and I'll be sharing it through our WhatsApp groups and on our page for those who are interested in learning a little bit more about us, and if you want to share with others. So the other thing and an exciting thing that I like to share about is our website hub. So through our website, we've been able to collect resources for a couple years now, and a lot of the things that we're collecting is based on each county on where can community members get healthcare application assistance, where can they get family support services or childcare, mental health services, and the list goes on. So with these resources, it's available on our website, which I will share right now, so that way you guys can see what it looks like. Essentially, let's see. Okay, so this is our website, and these resources and all the information provided through our website is completely available for free for all of you. And so if you were to go to our website and under resources, a tab or a list of information or topics will come up. And so if you were to go to the Maryland resources here, you'll find just some information in terms of just how to collaborate with us, but also health education flyers. So health education flyers are flyers that we have already found through other websites like the CDC, FDA, or all of these other organizations that provide health education infographics and flyers. So we've put them into categories in terms of pregnancy, infants, COVID-19, nutrition, and all other subjects and topics into these tabs right here, and they're free. So the goal of this was for us to help other community members or other community service providers have a place where they can easily find flyers that are available in English and Spanish. So we have some of these topics already available, and we hope to continue to grow this list so that way it is a quick way for case managers, for school personnel, or for whoever it is that's working in the community to go ahead, print something to be able to educate the community member on that topic. So that's a little bit in terms of like our health education flyers, and our resources for all Maryland residents. This is something that might be the most useful to many of those who are working in the community, is that it'll take you to this Google Drive here that we're constantly growing and changing, where you can access the SNAP application, the Maryland Water Assistance Program, some statewide mental health services, the internet accessibility programs, emergency Medicaid, which now probably won't really be used due to the Healthy Babies Equity Act because it was used for labor and delivery assistance. Information about the safe haven law, the Maryland Energy Assistance Program, cancer resources, and so forth. But if you were to go down by county, we essentially have these counties where we've been collecting resources for. So the counties that are going to have the most resources because of the background that I have in terms of working in these counties are Montgomery County and Prince George's County. So going into here, so let's say Prince George's County, there's the Prince George's Kaiser Care for Kids application if you are in need of the application. For those who are, with some of our information and infographics, and also the ones of the Department of Health to be able to, maybe print it and share it to a parent or so forth. But if you were to go in the resource packets in each county group, this is what you'll see: English or Spanish. So looking at the English one, we have started to create different folders on different topics that you can find flyers on of nonprofits or county programs that are providing a service in relationship to that topic. So for example, if we were to look at the mental health, these are some flyers of the nonprofits and the groups or that either federal, county, community, or whatever are based that Prince George's residents can access. So we have the pro bono counseling, we have 988, we have all of these other flyers here. This is not all the flyers that we have here throughout our resource drive. We are not sponsored, we're not affiliated necessarily with any of the nonprofits or programs that are there, but it's just us trying to provide a community resource drive so that way it's a little bit easier and a quick way to find resources. Of course, there's going to be some gaps in terms of finding maybe specific cases, but nonetheless, just bring that to our attention and we'll see what resources we can find to be able to upload it so that way next time somebody needs it, we'll be able to provide that. That goes without saying that if you are a nonprofit or organization that provides some type of community service that is low cost to free, and you have a flyer list of resources or services that you provide, and you'd like to upload it because you want others to know about this, we are more than happy to upload it. Just feel free to also send it my way, and I can upload it. Just let me know in terms of the counties that county residents that can apply for that program, and if it's available in English and Spanish. So in a nutshell, there's all of these different resources within each county that you can access. Again, it's very much free for everybody. The way that the way that community members access this resource drive is a little bit different. So we understand that the community that at least we serve, which is the Latino and immigrant population, there tends to be a digital access barrier or technology barrier, technology literacy, whatever it is, different names you can call it. We understand that basically there's a gap, that not everybody has a computer or is as tech savvy to be able to navigate through our websites. So what they get and what we do through our outreach is that we have keychains and magnets that have a QR code that takes them directly to specific resources. So for example, what they will see once they scan that QR code is going to be this simplified version of our website. So this simplified version of our website, we launched it in late April. And since then we've had over, I want to say, I think it's like 900 visits now, since we launched it. And that's just due to us distributing these QR codes and through the magnets, through our website, through our social media platforms and so forth, through our partners and the events that we do. So when they go to this website, this is where, they'll see our social media links that they can just tap and follow us. And then it takes them directly based on what county they are. That resource drive that you saw, this will take them specifically to that. So that way they're not clicking on multiple things, trying to figure out where to go. What will basically populate is that English to Spanish based on that county, and they can look at the flyers in that group. If you were to scroll down, so we have Howard, Baltimore, Frederick, Washington, D.C., Anne Arundel, Baltimore City, Prince George, and Montgomery, hoping to grow a little bit more in terms of the resources we're finding in each of these groups, but also in the other counties in Central Maryland. But I did want to pause there if anybody had any questions in terms of our community resource drive. I know it's a lot of information.
Yeah, good afternoon, Jhoselyn. The thing that I said there, they don't include Charles County yet, no?
What was your question?
I don't see they have Charles County as they have any research in your area.
For the shortcut to get into this?
Yes.
So to get into this, you can either access it through our website. So when you go to our website, let's say if you're looking at it through there, you want to see the simplified version of that, what we just looked at, you can go, you just click on resources, and it's this first one here that says community resources in Maryland. So that's one. We post the link also on our website and on our WhatsApp groups. We also have flyers on it that I can share with everybody, that you can just print it, and basically it's the same QR code everybody can access. Yeah. So, and then if you come across like flyers at health fairs and you're like, oh, this is a great flyer of resources or services that we need to get more people to know about, just send it to me and I can upload it on the Google Drive, and that way others can see that. Anybody have any other questions about the resource drive? No? Okay, and that's okay. So kind of moving a little on with the resources that we have. So that's kind of like our general list of resources that we have in Maryland that we're coming across. So kind of moving forward in terms of the other resources that you can find on our website is that we have started to create a list of information of resources that are specifically culturally sensitive to Latinos in Maryland. So if we were to look into here, we have some literature that we have been finding in terms of like research papers and just like Pew research that just goes into different things regarding the Latino community and just being able to best serve them for best practices. That's something that we have on here. We also have an upcoming training that I'll talk about at the end of today's discussion. But nonetheless, what you will see here is information in English and Spanish regarding medical and disability services in Maryland. We're trying to find all the information based on each county. So, that's why you'll see some of these links here. The goal is just to kind of be a quick hub, just source of information for others. So one of the biggest things I do want to say, when we're working with community members, like for the general public, when they're looking at us, we do not provide a direct service to them. We provide our services through our contracts and consulting services, through our partnerships, which I'll talk about shortly too. So nonetheless, here's just information, just prenatal care based on each county and the services. And this is essentially just to be, friendly to or having resources that are accessible in English and Spanish, low cost or free, that is just educating the community on that. So similar enough, you'll see that type of list of different types of resources of like what to do when you're pregnant, where do you get prenatal care services, where are the pregnancy and women's centers, where are there maternal health support groups, and all of that other type of information will be under our maternal health resources page that you can access. Similar enough with the mental health resources, you'll also see those type of resources available there. So kind of going and moving along with our resources for the conversation. So this website hub is a second way that we provide community resource education to our community, because we truly believe that many community members, as it's great as a workshop can be in terms of educating somebody on, if you have to go to your primary care doctor to manage your diabetes, to be able to eat healthy, these are the foods you got to buy. As great as those type of workshops are, um, the audience that we're targeting specifically, we know that there's a lot of social barriers. So it doesn't make sense for me to tell somebody who's uninsured to go to a primary care doctor if they don't have insurance, and if they don't know where to find a community clinic and all of those things, or even where is their food distribution sites because they can't afford weekly groceries. So we truly believe that accessing community resources like or programs like those that we have just mentioned is crucial and a big role in terms of having a healthy life. So through the WhatsApp groups, the website hub, and through our outreach where we provide I guess you could say like a printed version of a lot of the resources that we've been talking about so far. We give that type of education through our outreach. So again, it's not necessarily us that we're telling others that we're going to help them apply for all of these programs, but just more so the awareness of like where can they go, what are the programs they can apply for, and so forth. So we definitely, if you have outreach opportunities for us, we'd be happy to come to either your church, to schools, or to wherever, as long as we are available, we'll be happy to come out. We are a small, mighty team, so we try to attend as many as we can. Currently, our team is actually composed of myself as a health educator slash health coach. We have two other health coaches that are virtual. And we have a community physician who works with us in terms of like the clinical workshops, as well as two community health workers who are helping us with a lot of the things in between that, we're providing through community resource education and its access. So kind of moving on to our health coaching. Again, this says one-on-one health coaching, but I also do want to share that we do health workshops, and that's actually our biggest service that we provide. But so talking about health coaching in general, all of those on our team are bilingual in English and Spanish. Some of us are 100% remote, while others are hybrid. And a lot of the topics that we cover, just through our professional background in terms of like our expertise, and maybe credentials in those different fields, are pregnancy, breastfeeding, reproductive health, nutrition, and diabetes prevention. So we provide a wide range of different health workshops with our partners to provide education on, birth control, like how do you access birth control, or how do you use birth control, to, how do you exercise, if you have diabetes, and all of these other things in between. So we provide health coaching also one-on-one. That is probably the only service we provide directly to the general public, where they can, just like kind of like what about personal training, they're able to purchase like memberships in terms of like how many classes they want to purchase to get personalized and customized one-on-one health coaching in their preferred language, which is either English or Spanish. We do have a sliding scale for those who are living under the federal poverty line. We just do ask like, a couple documents to share with us just to kind of like, prove their eligibility, and they do receive a discount to be able to provide this. So, one example where this might come into play is if we have a family who, let's say, dad or grandpa is diabetes pre-diabetic, and the family wants to learn about, how can they prevent diabetes for the individual. So one of our health coaches would work with the family via Zoom, and they'll create a customized plan just to kind of educate and just skills to build to be able to prevent diabetes in the long run. So kind of engaging everybody in the family. So those are the type of one-on-one health coaching that we do. So it doesn't always necessarily mean one-on-one with another person, but maybe one with a family. So these sometimes these have been really these are services that have been asked of us from our community members to provide one-on-one health coaching because they prefer to have that private and individual education as opposed to in a group setting. So we started this initiative in response to what we were being asked of our community. The other part of this is that we do health coaching and health education through our partnerships. So one of the things I didn't mention is we are well, I guess it does have a section. Our consulting services is a wide range of different things in terms of um, health education and health coaching. So the way we do this is we are a vendor with Prince George's Community Schools, in which the schools in Prince George's County essentially have a budget, and they contract us for X amount in their budget, and they will request certain services from us. So some of those services will be either health coaching or health education, so providing health workshops for community members in English and Spanish, Zoom or in person. Nonetheless, that's something we discuss with them in terms of what workshops and the way we execute that. And the other thing with that is we do a lot of focus in terms of parent education. So the workshops that we provide with the schools who are partners, we provide these health education workshops for adults. So it's not necessarily students. Most of us, when we hear somebody partnering with schools, is that we're thinking about the youth. But as much as we know that youth are learning in school, and sometimes we'll have kids learn, about nutrition, and then they go home trying to, you know, maybe read a food label or eat healthier. But that might be something that's taboo or something that is not as known in their household. So, that gets forgotten and it doesn't get applied. So we lose that valuable information that they learn. So our goal as Coaching Salud Holistica is to kind of like help parents catch up on the stuff that their students are learning about in terms of health, and being able to kind of like support this multi-generational home um, in the learning process of health education. So we do a lot of things revolving that, and I'd be happy to elaborate more, through other conversations if you'd like to learn more a little bit about that. Kind of related to our health education workshops, our consulting services are provided to nonprofits, as mentioned, to schools, churches, and so forth, through typically grants or budgets that they have already acquired to provide these services. The other things that we do is professional development training. So our professional development training includes the Latino Cultural Humility Training. For those who might be familiar, we have this coming up in about 2 weeks, I want to say. And essentially, those who take this training are learning about the terminology, the subgroups, the beliefs and practices, the trends within the growing Latino community, and also what are the best practices for outreach and marketing, and many of the things that are just necessary to know when working with the Latino community. So this training, currently we have this live training scheduled for August 9th and 10th, which will be from 9 a.m. to 11 a.m. both days via Zoom. So this is a paid, or this is a fee that we have for our trainings. So we have different tickets for those who are interested, either individual, just live session or live and recording, or if they want to purchase a recording for their organization. So we have a whole bunch of these different types of training regarding Latino culture humility. We also have mental health first aid training. So for those who are not familiar, the same way we get certified for first aid and CPR, to help somebody who's having a heart attack or is unconscious and so forth. We have the mental health first aid training. So with that mental health first aid training, it's teaching individuals, this could be community members or staff, how to identify mental health challenges or substance abuse, or even mental health crises in our peers and our family and our community, and being able to appropriately approach them with evidence-based education and the resources that are needed to be able to refer them to the help that they need. So in a nutshell, that's kind of like what the mental health first aid training, it is a growing national certification that's provided through the National Council for Mental Well-Being. So that being said, another day with the mental health first aid training, the certificate will not say Coaching Salud Holistica. We are merely the instructors that provide this training through the National Council for Mental Well-Being. This certification is it's valid for 3 years, and you know it's one that's being recognized throughout the whole country. It originally started in Australia in 2000 and came to Maryland specifically in 2008. So we're one of the few states that actually has instructors, and are the only ones who can actually certify others in this training. This training is also available in Spanish for individuals. And I did want to also say that with the mental health first aid training, there's a adult version and a youth version. And what that means is, I guess you could, in terms of like, let's say community service providers, mental health first aid, the adult one is adults working with adults, and then the youth one is adults working with youth. So we have both trainings that we're able to provide. We are certified instructors through the National Council and are able to provide it in English and Spanish. I will pause there. I know those are kind of our biggest trainings and our most popular trainings that we have. So did anybody have any questions in terms of either of those two? Okay. So I did also want to say that all of our trainings and all of our services were available virtually or in person. Some we actually might recommend to be in person just based on the topic, but um nonetheless, it's something we're able to be flexible. The fees vary per participant. And so that's a conversation that we're happy to have with you, and just being able to kind of like figure out how can you get funds for it. The biggest way, especially if you're a nonprofit, is if you have a grant, being able to write us into your budget. That has been to prove most successful to be able to cover the costs associated with this. So next, a couple other trainings that we have, just going by briefly, is our health ambassador and CHW training. So teaching community health workers and health ambassadors a little bit more on maybe clinical diseases and just like health approaches and health education. So basically training the trainers. That's something that we do. Childbirth educator training. So I myself am certified childbirth educator with the International Childbirth Education Association. And we will be actually currently we do provide this training pathway to become a certified childbirth educator. Currently they only provide it in English, but once we're eligible to apply as a trainer for this, um, we'll be able to provide it also in Spanish, which the approximated date or time frame for that is going to be in early 2025. So we're still a little bit young and green for us to be able to apply for the trainer work ability, but we are able to kind of provide the pathway in English. We also do case management training. Case management trainings essentially are kind of those that are like teaching case managers on the different healthcare resources and services that are available in the community. So we've done case management trainings where maybe teams from a specific county need a little bit more education about, what are the different ways to apply for Medicaid, who would qualify, especially things about the Healthy Babies Equity Act, if there's uninsured, if there's undocumented, what programs are available for them. So we provide that type of training for case managers. And similar to the childbirth educator training, we are providing currently the doula pathway training. So doula is a birth work role that is very much important and growing field. And it's very a great opportunity for those who are interested in birth work to not only have this, professional title, but also to increase their social economic status. So just for reference, throwing out some quick facts for you, is that doula's starting pay is about 50,000, I believe, in Maryland, and it can go up to six figures depending on where they work, if they're self-contracted, and so forth. So doula is Medicaid reimbursed and insurance reimbursed based on the ways that they go about it in terms of building their business. But nonetheless, that's something we also provide. And one of the exciting things that we're happy to share, so currently all of these trainings are provided like live, like how we're having the Zoom session, or in person. But we are actually moving towards online self-paced professional development courses in English and Spanish. So for example, the only one that we're not able to provide, or the only ones I should say that we're not able to provide as online self-paced modules, is the mental health first aid, childbirth educator, and the doula. But all of the other trainings, like the Latino cultural humility training, the case management, the health ambassador and community health worker trainings, all of those will be available for online self-paced trainings. So, just like we all took maybe some online classes or have taken those trainings online, somebody will be able to essentially register to take these self-paced module courses, and they'll get a certificate. So that will be a little bit different from our live trainings that we do. But that is more to come. Hopefully, our expected time frame for that is going to be next calendar year. So starting hopefully by March, that we'll have at least one of the two online module trainings up and running. A little bit more about our consulting services with nonprofits have varied from, health workshops, from professional development trainings, to also community event planning. We've organized quite a few health fairs and community events in our community. We were I was co-chair of the Latino and Immigrant Outreach Work Group for Greater Riverdale Thrives last year, and was happy to organize the first Latino resource fair in the area, and it was very much exciting. We had, dancers, performers, we had a DJ, we had over 30 service providers, and we had over 400 community members who attended this event. So we do a lot of that in terms of consulting. We do, we help a lot of nonprofits based on their projects in terms to build community-based health education programs. So just kind of knowing where their targeted audience is, what is it that they're going to do, and just, everything that comes with that. Another service that we provide with schools, and this is something that we've been able to partner a lot with other community organizations, has been our case management services. So with our case management services, what we do is through schools, we get contracted to provide community health work or application assistance or case management services, which is very much similar in terms of that service that we provide. And so what that means is, like, say we have a high school or whatever school in Prince George's County that the purchase or contracted us for to assist about maybe 50 families in their school. on accessing all of the community programs that are available to them. So we'll have a community health worker, after we do an intake of all of the schools community, and we'll schedule them, we'll meet with them, and we'll help them apply for all the programs that they're eligible for, and just do also a little bit of orientation in terms of like other resources that they might be interested in. So we'll help them apply for Medicaid, we'll help them apply for Kaiser Care for Kids or Care for Kids, depending what county they live in. We'll help them access prenatal care service, so kind of knowing where to get it, and how often to go. We'll also help them apply for like the energy and water assistance programs, and many of the other programs that are available in the community. Just kind of educating them, like this is where you can get diapers from. This is where the food distribution sites are, and so forth. So we've had a lot of fun, being able to connect with our community in different capacities through Zumba, through health workshops, through community events, and many other things. So these are just some pictures I wanted to share with all of you in terms of our past projects. Some of our upcoming events is our Latino Cultural Humility training that I shared earlier, that we have available via Zoom. It is a fee, but if you work for a Maryland public school system, we are providing that training for free. So those who are working for the schools can just email us and we'll send them a separate registration link. On August 12th, we're partnering with Metamorphosis and a couple other organizations to facilitate and to do a community baby shower. We are doing this bilingual event from 10 a.m. to 2 p.m. at the Solid Rock Church, and those 60 moms that are currently pregnant will receive a little prize, just to kind of like help them celebrate, their baby and their pregnancy. So we're excited to help them connect also to various other programs like, how to access prenatal care services, WIC, finding diaper distributions, and many more. And we actually do have, I believe last time I checked, I think we had 40 pregnant individuals who had applied. We still have a little bit more space for those to come to get them. We also love to mentor various college students throughout our program. So each season, we've had the pleasure to work with college students from all over the world, actually. We had last spring a student who was in Argentina, currently studying medicine. And so she was helping us out. We have other students across this country. We have right now our summer internship students who are working on a presentation, because that is the final project that they do. Each rotation that we have of interns, they do a webinar. And this summer, the students have decided to do a presentation on maternal health in the Black and Brown communities. So they're going to talk about the trends globally in the United States and Maryland, what are the challenges within these communities, and then what are some tools to promote minority maternal health. So this is an exciting training. I'm very much excited to see, all the knowledge that they've been able to acquire these past couple months and being able to implement it in this free webinar that we are doing August 16th. We also do a lot of webinars. As much as we provide services that are like that require payment, we also do some free ones. So we love to do some free ones, especially revolving maternal and reproductive health. So we do have on August 29th, a in Spanish session on birth control. So anybody who's interested just wants to know how to figure out what birth control works for them, or just learning how to just, figure out how to use them or whatever, they'd be able to register for this session. And we always share resources in terms of like, how do you access, affordable birth control in your area. So we have those upcoming events. We also do have an upcoming event where it's the one on the left. It's a virtual session that is free on just education on how to have a healthy diet, balanced diet, to be able to promote healthy heart, because it is, I believe, heart disease prevention like week that week, I think, or heart awareness that week. And so we're hoping to just kind of educate our community members that are Spanish speaking and Latino, to just kind of know, like, how can they eat healthy, while still eating their favorite and traditional foods. So we have that session. And then we also have an upcoming training, that mental health first aid training that we talked about. We are running a promotion right now due to Hispanic Heritage Month, where we're providing this training in Spanish. So this is the adult version. And it's going to be via Zoom on Friday, October 6th from 9 to 5. And per participant, it is $130. So there's a couple ways you can register for that. It's via Eventbrite, through the QR code, or through our website. And then I also want to share that we have upcoming Latino Resource Fair, similar to like what we did last year, but a little bit on a smaller scale. But we are going to be doing this in Montgomery County in Gaithersburg, the Activity Center at Boher Park, for those who are familiar. We are currently still taking nonprofits, if they're looking to reserve a table. It is limited, so it is first come, first serve. We have kind of put that announcement out there. I think currently we have 20 tables still available for nonprofits. So if you're interested in that, feel free to send me an email or to reach out to me, or to even, I want to say we put the link up, but in case we haven't put the link up, feel free to reach out to me. That event is going to be October 7th, which is a Saturday from 10:30 to 1:30. We are providing table and 2 chairs for nonprofits for free, but we do have the opportunity for nonprofits looking to sponsor, to kind of get their name out there a little bit more. We have that opportunity too. We are also taking businesses who are interested in reserving a table, but businesses do have a fee in order to be able to attend the event and to sell at the event, which is $50. That's just to help cover a little bit of the costs that are associated with running this event. But lastly, feel free to always reach out. I know that's quite a handful in terms of like who we are, what we do, and why we do it, and like who we provide these services to. On our website, you're more than welcome to see our past and current projects, just to kind of get a better sense of like what we do. And follow us on social media. We're constantly sharing resources there. So we're always trying to get community members to kind of, check us out, just to kind of stay up to date with what we do. But nonetheless, did anybody have any questions or anything before we end? And then let's see.
Hi,
Hi, how are you?
I'm good. How are you?
I'm good.
I just want to say thanks for putting all this together. I know it's a lot of information, but really so helpful. Because I'm located in a program in Anne Arundel County.
Mhm.
But we do have some participants that look for resources in PG County. But I was wanted to ask, the best way to reach out to you to maybe brainstorm a little bit about like how we could help you get some resources on your board, or how you could bring resources to our families. Like, is email the best for you?
Yeah, so email is probably the best way to get in touch with me. So that is absolutely the best way. And we are looking to work into other counties. So if there's any opportunities to collaborate, we'd be happy to. And I'd love to set up some time to talk more about, what you're seeing and how we can support each other. And I will be
All right, I'll email
yeah,
you.
yeah, sounds good. And I'll definitely be sharing the recording with everybody. So if you want to rewatch it, just kind of share it with maybe with your team members. And I'll also be following up with the email, so where you could just email me directly from there. Yeah. Anybody else that had any questions? I know it's a little bit of information, especially after a Monday. So yes, Nancy, I will be sharing that. Okay, well, I mean, if there's not any questions, I'll let you guys, get a couple minutes back to your time, afternoon. And I absolutely hope to connect with all of you in different capacities, and even if it's just to kind of learn more about what you do. But thank you so much, everybody, and I absolutely hope you have a great weekend and stay cool. It's very hot lately, so I want to thank you all, and yeah, look forward to touching base with everybody.
Thank you.
Mhm.